Nearly 2 decades after Hurricane Katrina struck New Orleans and 4 years since COVID arrived, we still find ourselves asking, why are some communities disproportionately harmed by natural disasters and emergencies? And what can be done about it? Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz Podcast, a weekly show where I interview top healthcare leaders about their lives and careers. My guest today is Tom Cotter, president and executive director of Healthcare Ready, which brings together the public and private sector before, during, and after emergencies to protect at-risk patients. If you like this show, please subscribe and leave a review. Tom, welcome to the Health Biz Podcast.
David, thanks so much for having me. Pleasure to be here.
Outstanding. Well, before we talk about Healthcare Ready, let's talk about your background, your upbringing. What was your childhood like? Any influences that have stuck with you?
Oh, gosh. Yeah. I mean, it really did take a village to raise a child like me. And, you know, I, even as a young man, my parents instilled in me a spirit of volunteerism, which has served me well, I think, in my career. Where I remember my mother bringing me to serve food at food pantries and things like that. And there is one moment that I think sticks with me the most. If you remember the late and great Paul Farmer, and as someone from Boston, I'm sure you do.
Yeah.
He came to speak at my high school. And this was just after Tracy Kidder's novel Mountains Beyond Mountains came out. And it was kind of a big deal. And my entire high school was in the gymnasium. This is at Boston College High School. And it was time for questions and answers. And I remember raising my hand. And after hearing Dr. Farmer speak for some time about all the change he's doing in the world and how everyone needs to be doing their part, and saying, hey, listen, Dr. Farmer, not for nothing, but I'm just a regular high school student. There's not really anything I can do. And in front of my entire high school, all my friends, he said, well, if you believe that, you're an idiot. And, it was a tough love moment that I think really steered a lot of where I went post that moment. I think the world lost a great one with his passing. But I know, his organization, his spirit of, reaching out and meeting people where they are is so important and so valuable lesson to learn, especially as a young man.
That's good. Well, in case you were going to forget that lesson, it sounds like all your buddies are there to remind you about it. So,
oh yeah, lots of quotes in the yearbook about that.
Yeah, that's a good one. Well, and then I saw education-wise, for somebody who's not a professor, you've been to a lot of different universities, and I saw maybe somewhere in that spirit of volunteering, I saw a stint in the Philippines. I think even when you were in school, what was your higher education path? Help unpack that a little bit.
So I got a master's in public health with a focus on international health and humanitarian emergency response management from Boston University. And part of that study, part of that curriculum was you had to go do field work. And there was a good-natured jab in the international health concentration that the program mandates that you do 60 hours of quote unquote field work. And in the international health department, they said it should take you 60 hours to get to where you're going to start your field work. And so, kind of through that and with a lot of encouragement, support from the school and from my friends and family, I decided to move to Manila and pursue, at least a semester of study at the University of the Philippines, specifically around the socioeconomic impacts, determinants of health, I should say. And it was phenomenal. It was a great program. It put me in places that I never could even imagine as someone who grew up in the South Shore of Massachusetts.
Yeah.
And, anything from collecting snails to study schistosomiasis and how it's impacting farmers' health. And I won't go into the weeds on what schistosomiasis is, but suffice to say, we don't have a lot of it here in the U.S.
We don't have it here, and we don't want it.
No. Stay away from snails. But down to understanding how people are paying for healthcare in the central part of the Philippines in these rural, really remote island chains. I spoke to some folks in a small village in the province of Samar who they raise pigs. and the pigs are the community pigs. And whenever somebody gets sick, they sell a pig, and then they
Yeah.
get a piglet, and that was their insurance. That was their insurance plan. So it really taught me, the strength of community innovation, and really that international lens of what's working over here, what's not working over here, that we can apply into our current situation, and likewise. It was fantastic, and I think I'd be remiss if I didn't mention that. I didn't start this kind of health equity expert understanding socioeconomic status and historical injustices that have led to our current situation. There's been a lot of people in my life, a lot of people who have explained patiently and sometimes not so patiently, to give me course corrections around my thinking and understanding about why things are the way they are, whether it's in this country or others. And I owe them a great debt. I owe them a great debt. I'm not there. There is no finish line to this, but they've given me a huge boost and being able to support programs and communities that I think I'm well positioned to do so, and it's a privilege to do so.
So I saw at some point, and maybe kind of throughout your career, you've been an EMT, like riding ambulances in between classes, or how does that worked out?
That's kind of exactly what happened.
Yeah.
I think it helped me to have Saturday nights reserved in college to ride on an ambulance rather than spend a bunch of money on alcohol.
Yeah.
But I could do that all the other 6 days of the week. But it was great. I think it was really important in understanding, not only the wholesale application of health, but what I call the retail application, the
Yeah.
patient encounters, and developing a compassionate bedside manner, developing the ability to be decisive under immense pressure, being able to work as a team for a common outcome, and treating the whole patient. One of my favorite things, and I learned it from another EMT, I can't take credit for it, was when you have a kid in the back of the ambulance, you better be blowing up a glove and writing a face, drawing a
Yeah.
face on it, and kind of leveraging personality and leveraging your whole self to treat that whole self. I think is really great, and I think there's no substitute for direct patient care when it comes to that one-on-one, and having someone rely on you and trust you, and wanting to follow through with that with all of your whole self.
I think it's a great experience. I often speak to medical students or others that are doing that. I was just actually coaching my nephew who's wants to be an EMT part time and do medical research the other half as he graduates from college. I said I think it's a good idea. So
It's huge. If you go in, I was pre-med, so I'm allowed to say this,
yeah,
but if you go into med school and all you've got is pre-med under your belt, you're missing a critical part of patient care. Same thing with public health. If you're going to be a public health practitioner and you graduate from your MPH and you haven't really done any one-on-one health
yeah,
practicing, I should say,
yeah,
go find those opportunities. If you're an
yeah.
undergrad listening to this, if you're in a higher education listening to this, go find those opportunities to be a volunteer EMT. It's fantastic.
Yeah. Well, I promise that if you get EMT certified, you will be able to find someone to ride the ambulance with because they need them right now. So
100%. Yeah,
yeah,
or any other medical profession for that matter.
that's true too. So all right, AmeriCares. So you spent some time at AmeriCares. What's that about?
Yeah, so AmeriCares, I was fresh off a stint doing domestic preparedness work in the DC area, and developing exercise and trainings for emergency managers and decision makers. And I didn't love it, to say the least. It was a fine, and I was happy with the work, but there was always that part of me that wanted to go back into the international realm. So an opportunity came up with this NGO called AmeriCares in Connecticut to develop a emergency response function. Um, and one of the things that I think I developed there and then brought with me, in future jobs like Project Hope, which I'll talk about in a second,
Yeah,
was the decentralization of emergency response. So we've got this idea of international emergency response, and you could draw the parallels domestically as well, where we send, frankly, white middle class people, volunteers who have the best intentions. There's no doubt in my mind, everyone has the best intentions, and we send them to places that are affected to do work, whether it is medical volunteering or even unskilled labor, building houses and things like that. But if you decentralize that model, you now are sending much more resources, a bigger percent of resources that you're getting as an NGO down to the communities that need it. Not down, but over to the communities that need it, I should say. And it's a model that is really effective because there's a lot of competent people when disasters hit. And there's always going to be need for help. I'm not saying nobody should go ever, but I think being really discerning in terms of, listen, do we need to send a medical team to the Philippines when they've got one of the most robust nursing fields in all of Southeast Asia and frankly the world? You know, we're importing Filipina nurses faster than anyone else. Do we need to send medical teams? No, but what can we do to ensure and to send resources and train and provide technical guidance so that there is not that dependence except for resources? You know, my goal is always to, you know, and every other humanitarian is the same, which is we want to work ourselves out of a job, and
Yep.
this is how we do it. We provide the structure and support that is asked of us, and then we just send resources, money, technical expertise, maybe a person or two, and that way we're kind of breaking this cycle of dependence. And indeed, I think we're also finding ways to invest in the preparedness and resilience to mitigate the effects of these disasters. So I went from AmeriCares to Project Hope, and Project Hope is a fantastic organization. I was their first director of emergency response, and I took with me that this lesson, and I was working for and with people who were true believers, true humanitarians who said, you know, this is why we hired you to do this job, is
Yeah.
because we're drinking the same, you know, Kool-Aid as you, and we've got country offices all around the world. We want you to come in and train them all how to do emergency response so that they're not dependent on us at the DC office to do it. And it was largely successful. I went around the world and trained people so that you know, we had these focal points around the world where we would just send money and resources to these teams, and they could manage their own responses, and I would provide technical expertise. This became really important at Project Hope because about 6 months into my tenure there, that's when the pandemic hit.
Right.
And all of a sudden, we couldn't travel anymore. It wasn't even an option. So now this model is not only very cost effective, very much culturally appropriate, and has that cultural humility aspect to it, but now operationally it's mandatory. So now when we get a volcano going off or a hurricane in Honduras or any of the other natural disasters, we're reliant on our local partners. We're reliant on our local colleagues, and you know, I think it was very validating to see that work, and it's something that Project Hope continues today. I think they're doing a great job.
That's great. All right, I see how all these themes are coming together here. So let's talk about healthcare ready. And my understanding, and I have a vague recollection of it sort of coming together after Hurricane Katrina, but how did this organization come into existence in the first place?
So Hurricane Katrina, obviously a lot of lessons learned, and we'll talk about that at some point, I'm sure. But the one of the great frustrations was there was a lack of ability for private sector corporations to lend resources to the larger response. So, a Pfizer, for example, or a Cardinal Health, or a the distributor formerly known as AmerisourceBergen, now Cencora, they weren't able to effectively integrate and collaborate and coordinate with FEMA or you know, HHS or even local government. And it wasn't anybody's fault. It just wasn't a system that had been set up. So they developed Healthcare Ready to be that facilitator, to say, listen, here's a 501c3 nonprofit, and that's what Healthcare Ready is, that can come in and facilitate these discussions and essentially match resources to unmet needs. And of course, corporations have a fair amount of resources, and they're really invested in the communities in which their staff work, in the communities that they are working with patients in, and so there was a lot of vested interest in this. So Healthcare Ready was born of that need, and our mission still does, you know, closely align to our inception, which is we try to manage and facilitate public-private partnerships and coordination and collaboration to meet patient needs around the country and around the nation. And I think what I bring to this job, and I've been here for about a year and a half so far. I'm still kind of the new guy,
Yeah.
but I think I bring that international lens and that that desire to find local partners and send them resources and training, and it creates a much better environment, I will say, for response where it's not top down. No program, especially around healthcare or anything else, should be according to life according to Tom Cotter from the South Shore, Massachusetts. It should be what folks think they need and what folks are asking for. And so by bringing that into our identity, I think we're much stronger than we ever have been. And we've been a great organization for a long time, and have been doing aspects of this. Health equity has been at the core of everything we've done since the inception. There's a recognition that that's inseparable from our mission and our work.
So Katrina was a while ago. It was a real wake up call, both and inspired folks to start an organization like Healthcare Ready and a lot of other changes as well. What has changed since Katrina in terms of the overall, readiness of the country, or just the attitude toward these sort of disasters and what you do about them?
I think Katrina was one of those moments, and I think the pandemic was another one, and I'll even invoke 9/11 on this, where we saw how bad it could get. And I think that, when I think about the pandemic, and I'll come back to Katrina, but when I think about the pandemic, early February, I'm sending a message to my parents saying, "Hey, get 2 weeks worth of goods
Yeah.
and maybe a mask or two." And it's like, I didn't even have the imagination, even with my background, I had no imagination how bad this could get. And I think that was an inflection point as a country, Hurricane Katrina, where we understood, here's how bad it could get if we don't set up proper mechanisms that are well thought through, and better information sharing, better work collaboration, better engagement at the local level by federal entities, and we're seeing that, right? It's not perfect. It's never going to be perfect. Every disaster, we're going to find new ways to improve it. But we're finding a lot more robust emergency management, I'll say, bubbles that now are closer aligned with each other, whether it is at a tribal, a state, a local, a county, federal, etc. level. And then you have, now hospitals have really robust incident management systems. They're activating HICS, and I hope they're activating HICS regularly for a lot of different things and scaling it appropriately. But again, I think it was a lesson in connecting the dots, and I think a lot of the dots are connected. The lines can be more bold. The pen can be pushed into the paper harder, but I think we're in the right direction because of that lesson learned. And again, we paid a heck of a price as a country, and certainly the people who lived there before, during, and after. But hopefully it was a lesson that was well learned and not just a lesson observed.
What are the challenges beyond just the lack of the mechanism for coordination among the different organizations? Was just it's hard to get medical records and prescription records, even if they were digitized in some form or another. Now, not related specifically to disasters, but more broadly, the federal government has been involved in more interoperability and trying to address this question. So, as you look in, sitting here in 2024, is it a different starting point just from that standpoint? So you still have to get the different groups together, but then they've got more infrastructure to work with at a federal level, or do you not see that come through so much?
That's a very good question. And it's a very complex answer, because I think that there has been the infrastructure. If we look at the country's pandemic response, and when we're talking about interoperability, there was a lot of successes. There was lessons observed and lessons learned, but there's a lot of successes. ASPR, under HHS, the Administration for Strategic Response and Preparedness, or Preparedness and Response, rather, they found that their procurement methods were not robust enough that would allow them to buy a bunch of masks or whatever supplies, or hire a bunch of people. So they turned to the Department of Defense. Department of Defense is very good at staffing up
Yeah.
and getting resources very quickly. So that was a pretty interesting, I think, case study of that interoperability kind of shoring up a larger response to be all alignment. But as I talk to you today in 2024, we're not operationalizing a lot of the lessons learned from the pandemic that I'm afraid we're losing momentum on. If we look at post Katrina, post 9/11, massive movement across government to ensure that this never happens again, or if it happens again, it's never as bad as it was. And it was like a whole of government, and it wasn't perfect. There was a lot of things that could have gone better or could have been thought through better. But right now, we're looking at cuts in public health spending. You know, a year and a half outside of a acute pandemic that cost a lot of people's lives and untold economic damage to the world, let alone the country. We're cutting funding on that. So when you talk to me about infrastructure, yes, but it needs to be maintained. We a lot of the things that we put together with chewing gum and paper clips that worked during the pandemic, it needs to be reinforced,
Yeah.
and that's going to take a lot more resources and a lot more investment on the government's part.
You have something called RX Open. What is that, and how does it address some of these issues we've been talking about?
RxOpen is a tool that Healthcare Ready established many, many years ago. And originally it was designed to communicate the operational status of a pharmacy after a disaster, where most people get their healthcare. That's most people's intersection with the healthcare infrastructure is at their pharmacy. And so what this tool is, it's very simple. It is, of course, the team that works on it will not be happy with
Yeah.
me saying it's simple because
No.
it's not. But as a user, it looks very simple. It's a Google map. It's a
Yeah.
Google map with colored pins on it. Green means open, red means closed. And so we activate this after a disaster, and we get data from a lot of different sources to ensure that not only patients know where to go get medicine and providers know where to send patients to go pick up their prescriptions, but emergency managers can also see, oh my, all of the pharmacies are closed in this particular county or this neighborhood. We need to move in that direction. Now, since that original creation of it, which was I think a stroke of genius by our predecessors, we've now added dialysis center operating status, thanks to our partners in the dialysis realm. And this year, we're actually adding substance use disorder treatment centers, free and charitable clinics, community health centers, and hopefully hospitals into RX Open so we can provide a much more comprehensive picture. With the aim, of course, of making sure that both decision makers, but more importantly, providers and patients can make informed decisions and get access to the things they need when they need it. In disaster, demand goes up and the access tends to go down. So this is a tool that we develop and operate for that purpose. Alongside RX Open, we also run a hotline, which you can find on our website, rxopen.org, but also healthcareready.org, that patients call all around the country and they say, well, I've lost access to this. Can you help us? And we operate a bespoke service to ensure people can get an Uber ride or can get emergency electrical supply if they've got electrical dependent equipment keeping them healthy. So we do this. I call it wholesale and retail aid, and it really allows us to, I think, serve the communities that need us really well.
So let's talk about now maybe a less abstract question about infrastructure and federal policy and all that, and maybe more concrete. Talk about a recent disaster. So let's say like the Maui wildfire. That was another comparable thing in the sense, I think, to Katrina, in that it just, although wildfires are known and you might expect it, nobody expected something that big and that devastating that fast to happen, and a lot of the initial response systems broke down, causing a lot of problems. Did you have a role in that wildfire, and how did it go?
We did. I think once we understood the massive impact to that particular and again, if you look at the numbers, it wasn't as big as Katrina, but that doesn't matter to a community that is an island, and B is so devastated in such a comprehensive way. It's really hard to imagine not only your home being affected, not only your kids' school being affected, your business is affected, your roads are affected, your everything has been thrown up in the air, and everything's in question right now. And so, Healthcare Ready, our response, typically we do what we do every day, which is public-private collaboration coordination, having unmet needs to available resources. But what we found in Maui, which I think was interesting, is that, and we've seen this in other times too, but we decided to try something new, which is there was a lot of health and medical NGOs, nonprofit organizations from across the country with significant resources. I mean, these NGOs bring a lot of time, talent, and money to their emergency response work. And typically, how NGOs coordinate in a disaster is through the national system called National Voluntary Organizations Active in Disasters, VOAD. And VOAD liaises with FEMA, and FEMA liaises with VOAD, and it's a really, I think, a good system. Um, but health is so specialized, it doesn't necessarily fit within that. Health is not in FEMA's mandate. Health is in ASPR's mandate. So what we approached VOAD to do was, do you mind if we set up a health and medical working group to coordinate the specialty health and medical assets that NGOs are bringing to the table? And they said, yes, that seems like a good idea. We've got all
Yeah.
these health and medical NGOs. And so we started having calls, and we started working to liaise with the Hawaii Emergency Management, Hawaii Department of Health, Maui, same thing, and ASPR. Um, Again, for our usual mission, which is supporting communities that need us the most in an equitable way by meeting unmet needs. And it wasn't perfect. This was our first go at it at Healthcare Ready, but it's led to a lot of really interesting conversations. A couple of weeks after that, I got called by Hawaii Emergency Management to do a debrief, which again has never really happened in
Yeah.
this country. I was so floored that they were like, this thing happened, and we should capture the lessons learned from that. There in the U.S., you have to understand there is no mechanism for health NGOs to coordinate directly with departments of health or to coordinate directly with ESF 8 functions, Emergency Support 8, which is health and medical. We saw the same thing in Hurricane Maria, right? So again, floored that they wanted to unpack what happened. And it showed a real, I think, positive deviation, as we call it in the public
Yeah.
health field, of we want to include more people into this. We saw that you brought a lot of resources. We weren't able, right, for very good reasons, to leverage them maybe to their absolute effectiveness and efficiency, but we could do better next time. And it's a real ground shift. I can't overstate what a
Yeah.
ground shift this is. And again, this is a no fault statement. I'm saying the country's emergency management infrastructure is not set up to engage with outside players, to engage with NGOs, to engage with corporate. There's individual external affairs departments, but not in a real comprehensive, really in the weeds, sharing data, sharing resources kind of way. And so that's where we come from at Healthcare Ready. And so our role in Maui was to be that facilitator, and I think this is something we're having conversations at very senior levels of government to improve, enhance, and expand, as well as with the NGOs themselves to understand, here's how you work with the U.S. government. Here's a good way to work with the U.S. government, because a lot of the NGOs, especially the national NGOs, including myself from experience, we're used to working internationally. Now,
Right.
internationally, it's a whole different ballgame. Governments are really willing and able to build a long table for you to come in and to directly support their mission and their objectives and share your data as an NGO, under what's called the cluster system and others. And you go into an EOC in a lot of different countries, especially in the geographic South, you'll find a lot of NGOs there, as if they were part of the emergency management network, because they are. And in this country, the government has not had any kind of reliance on external partners to any significant extent. And I think the pandemic, was a huge win on the public-private coordination and how quickly that got set up. But there is no I think there's a lot of sensitization and socialization in this country
Yeah.
about the amount of resources NGOs bring, the amount of willingness that corporate America has to lend their resources to a particular response. So that's one of the lessons I think I bring, from my experience internationally, that a lot of people have. There's nothing particularly unique about me, but I see us going in that direction, and it is really, I think, encouraging for a lot of us. And keep in mind, a lot of the national NGOs and local NGOs played a huge role in the pandemic response, played a huge role in communication, public health communication, played a huge role in mobilizing communities and getting people out to get vaccinated. More of that, please.
Sounds good. Well, Tom, I have a last question for you, which is going to turn a little bit away from what we've been discussing, unless you turn it back. And that is a question about if there's any good books that you've read lately and anything that you might recommend to our audience.
So it's an interesting question. Um, I am about to become a new father. My wife and I are expecting our firstborn in a couple months. So I am knee deep in every being a dad for dummies book you can imagine. So I'll recommend one of those, and I'll go to one of my favorite books. But the one that I like the most, if you're about to be a new dad or even a new parent of any flavor, is The Expectant Father by Armin Brott. It's not condescending, it's not too broy, but it's funny, it's science based, and I recommend that for anybody who's expecting. Um, Now, one book, and I'll probably take us back to some topics we touched on before,
Sure.
but one book that I always recommend, and I actually read this in college, I probably read it a dozen times since, is called The Spirit Catches You and You Fall Down. And it's written by Anne Fadiman. It's an older book. I think it was written in the 90s. But what it does is chronicle in a very compelling way the journey and the experience and the frustration of a immigrant family from Southeast Asia with the U.S. healthcare system. And it follows the family as they're kind of battling this really significant acute needs of their child and the misunderstandings. And it tells it from both the doctor's standpoint and the family standpoint.
Yeah.
And I want to tie that back to what I said earlier, around health equity being at the center of what Healthcare Ready does. We focus a lot on cultural competency, and I think that's a red herring. I think we need to focus more on cultural humility. And it's at the core of Healthcare Ready's mission, again, doing a needs-based response and asking people what they need. They'll tell you, I promise you. And having that humility to not come in with a intervention in mind or a program in mind. Listen to people. I think that's my biggest takeaway. It served me well. It served Healthcare Ready well. And I hope it serves your audience well.
Great. Well, Tom Cotter, President and Executive Director of Healthcare Ready, thank you for joining me today on the Health Biz Podcast.
Absolute pleasure. Thank you, David.
You've been listening to the Health Biz Podcast with me, David Williams, President of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.